First of all, COVID-19 really has shaken us up in terms of how do we deal with something that's totally unanticipated. It's more so troublesome because it has devastating impact on cancer patient. If you look at the studies that came out from originally from China as well as other parts of the world, cancer patients have 3 to 4 times high likelihood of capturing COVID because of the immunocompromised state. And when they get COVID, they have much higher morbidity and mortality resulting from the COVID-19. So the first thing I want to hear from my fellow colleagues on the panel is that how are they navigating their own operations, how they are trying to minimize the risk of exposure, how they are incorporating telehealth to minimize the inpatient visit to the patients coming and getting exposed to the other patients. And second biggest uncertainty is when and if the COVID-19 pandemic is done, we'll have an onslaught of many uninsured patients. We are still not seeing the true impact of how many people will be unemployed, how many people will be losing their livelihood, and how we are going to deal with maybe 5 or 6 times the unemployed patients who will be losing their healthcare benefits, how the pharma industry is going to work with us to increase the patient assistance program. So access to care will become a much bigger challenge going down the road. And I'm not sure what the impact it will have on the healthcare providers as well. Some of my colleagues have passed away in New York. We already had some short supply of the certain physician specialties and how it's going to impact the burden of the cancer patients on the practice already here. And the last point I want to make is many places went for stopping all elective procedures. So we'll see a lot more patients with more advanced cancer, and how we're going to again, deal with the challenges of disproportionate number of the patients who are uninsured with much advanced disease. I definitely want most of my colleagues to access these meetings because it's a blessing in disguise in a sense that traveling in person would actually take time away from the clinic and not being able to access the care. But in a virtual meeting set, I can essentially reshuffle my schedule here and there to accommodate my patients at the same time, learn most. And because most of the esteemed faculty, for example, if we had live in session meetings, I'm not sure how many of the faculty would have traveled, but with the number of extremely distinguished faculty that we recruited this time, I do feel that we'll learn a lot more from everyone's collective experience. And again, these are the unusual times we are learning and leaning on each other of navigating through the pandemic and how each and every one of us is working to keep patient care going on without reducing the access. So it's going to be collaborative, cooperative, cohesive learning from each other in this pandemic.